Hello, my name is McKenna. I'm going to be the nurse today. I'm cleaning my hands with hand sanitizer, and do I have permission to record you?
Yes.
Great, thank you. Can you tell me your name and birthday?
Seth Creason, 08-1798.
Perfect. We're going to be doing a skin assessment today. I'm going to start with any just questions about your skin health. Do you have any skin conditions, issues with your skin, history of skin cancer? Do you tan at all, use tanning beds, or go out in the sun?
No.
Okay. Just as a reminder, you should always use sunscreen when you go into the sun to prevent skin cancer.
Okay.
All right, so we're gonna start with the inspection of all 4 of your extremities. So first, I'm just gonna look. Okay, look here as well. I'm touching as I go to palpate the extremities and look at your skin, same with your legs. And then I'm also just going to look at the front and back, assess the skin back here as well. It doesn't look like you have any lesions, moles, or bumps on any of your extremities or skin. Is there anything that you've noticed?
No.
No? Okay. It also seems that you have even hair distribution on your extremities, chest, and back. And your skin is warm and dry. I'm going to test the mobility and turgor of your skin. So I'm going to pinch up, mobile, and it goes right back in place, which means you have normal turgor. Same here. We'll do it on all 4. Perfect. And it doesn't really look like you have any wounds or skin breakdown. I noticed you had a little bit of a bruise right here. Was that just from an injury?
Yes.
Okay, perfect. And then now I'm going to assess your scalp. So I'm going to look through your hair here. Looks like your hair is evenly distributed. I don't see any lesions, bumps, or moles. The color is all the same. I don't see any insects, sores, dry skin, or anything like that. Have you noticed any problems with your scalp? Great. All right, we're gonna move on to your nails. So I'm gonna check your nails on each of your extremities. It seems like you have pink nail beds on your hands, and your capillary refill is less than 2 seconds. Perfect. You have a flat nail shape on all of your fingers, and there's no clubbing. The nail bed is intact and the nail is intact. Okay, and then I'm going to move on to your toenails here. Same thing, so I'm just going to press, make sure your capillary refill is less than 2 seconds. Your nail and nail beds are intact, and the nail is pink and the shape is flat. And then we're just gonna do a little bit of education about skin cancer and kind of what to look out for. So you can remember it with A, B, C, D, E. A stands for asymmetrical. So if you notice any moles or lesions on your body, they should be even on both sides. One shouldn't be larger or, not symmetrical. The borders should be even. None of the moles should go outside of the border. The color should be the same, so if you have a mole, you won't want to see it with multiple colors. If it's just brown, it should be the same shade of brown. And then the diameter should be less than 6 millimeters, which is about the length, or like the width of a pencil. And then evolution, so you want to make sure that none of the shapes or sizes, colors are changing, and that's like a sign of melanoma. Do you have any moles on your body?
No.
Any noticed changes through time?
Mm-hmm.
Okay. Any questions?
No.
Okay, thank you.
Thanks.